Are you getting knots or pinched nerve feeling along this muscle here, where it feels like you're getting this searing, like ice pick stabbing sensation along this area here between the shoulder blade and the spine? You tried massaging the heck out of it, but it's still not going away? Try this instead. My name is Dr. Nick. I'm a physical therapist where we specialize in helping people 40 plus stay active and independent, live free from painkillers, and avoid surgery. I see a lot of patients who come to me with this pinched nerve kind of pain, and they're always telling me it feels like a pinched nerve, this kind of searing pain in the shoulder blade area. These are actually called Cloward signs, and we'll talk about it. These are signs that have been mapped out to show knots or trigger points in the muscle, this kind of this upper trap and rhomboid area that come right along the top of the shoulder blade and dive down along this inside rim of the shoulder blade in between the thoracic spine and the shoulder blade area. And there's very reproducible points along this trap muscle that everyone wants to massage, wants to roll out, wants to stretch, and it doesn't seem to take care of any of that pain. Often can lead to things getting worse. And the reason why is because they're treating the wrong part. The reason they have this kind of pain down here is actually because of disc herniations in the cervical spine. And the reason why these things are mapped out so well is because they've actually done injections where they'll put in lidocaine, a numbing agent, in these certain spots, and this pain will disappear. So we know if we don't treat the cervical spine and we don't perform a treatment protocol to treat the discs, this pain will never go away, and you'll massage and massage and massage, and it will never get better. And the reason for this is because there's actually a nerve. If I were to flip this muscle over, and it comes all the way down through here, that's the nerve that carries a signal to refer or radiate pain from the neck down into this region here. And depending on what spinal level you have that disc herniation will determine where you have those knots that are so irritable and unremitting, never going away. So instead of massaging and stretching, do this instead. So this is the first exercise. What I like to do is get to a wall. If getting to a wall is uncomfortable, you can do it laying down on your back. That's totally fine. But the wall just gives you a bit more of a cue as to what vertical feels like. And so as she gets to the wall, Alana's going to be here. Shoulder blades are going to be pressed into the wall. And so she's going to flatten them out. As you lay in against the wall, you might feel like your shoulder blades are poking into the wall. As you retract them or pull them back a little bit, you'll notice they'll flatten against the wall, and that'll feel more comfortable. As she does that, she's going to think about pushing her fingertips down towards her shoes, almost like you're dipping your fingertips into soil. Straight down. Your shoulder blades are still going to be flat to the wall. And then her head and neck, she's going to rest her head on the wall, and you might notice that your head goes up. As your head goes up, you're then going to bring your chin back down. So we're actually retracting our chin back down. You're going to notice a little bit of tension on the front part of your neck. Those are the deep neck flexors. And so we're working on strengthening these to help support this progression that we get going forward with our neck, so we stay tall and vertical, and that's going to decompress the pressure from those discs and give us more space and room to get less pressure and pain down the middle of the back. You're going to stay here and hold 5 to 10 seconds and then relax. But the biggest thing is making sure you reset every position. So shoulder blades flat against the wall, fingertips digging down, head's resting against the wall, and then chin is straight back towards the wall. It's not the most glamorous exercise. It's going to feel like you're giving yourself double chins. That's okay. That's exactly what we're trying to do. And you're going to hold 5 to 10 seconds, repeating 10 times. The next exercise, you'll need a pillowcase and fold it up just so it stays flat. Put that behind your neck. Now, just below the head, not so low, but just below the head, kind of in the middle of the neck. And what you're going to do from a profile view is you're going to begin to look up. As you look up, you're going to notice the towel is going to be kind of in the way. Once you feel like the towel is supporting your head, that's when you start to lift or press away. And then we like to lift a little bit more. Now, this is not a tricep exercise, meaning I don't want you to feel like you're having to put a lot of pressure and you're trying to lift your head up. Okay, you're not. What you're trying to do is just lift, to lightly unload your neck from your shoulders. It'll take a little bit of time to dial in what that unloading sensation feels like, but it should be relief. So as you look up into extension, you're then going to lightly lift or unload and hold 5 to 10 seconds. As you do that, you should feel that nerve pain, that pinched nerve sensation dissipate. It should start going away. And then you can come back down. Yeah. And you're going to do this 5 to 10 seconds, 10 to 15 times. And this is one of those you can do regularly throughout the day. This is not one that you have to worry about getting irritated or causing more problems. Really, the only thing is, do your triceps get tired? It's a little bit of an unloading. That they're active, they're involved, but it should not feel like a tricep exercise. Just keep it very light. This exercise is perfect for that pinched nerve sensation you get between the shoulder blades just below the neck that never seems to go away no matter how many massages you do. I have a video where I describe in depth more of this kind of sensation, more of these symptom presentation, and I'll leave a link to that video in the description below. So watch that video if you want a more in-depth explanation of that pinched nerve sensation. This video is a demonstration of the exercises I prescribe to get relief from that condition. If you found any of this video helpful, please consider subscribing.